talk about hormone replacement. What are my options? So it's kind of been a hot topic. I don't know if you guys have seen stuff in the news. I mean, I think a few years ago Oprah had a big thing about it, and I think Suzanne Summers wrote a book about it, and all kinds of stuff. So it's definitely in the limelight, that's for sure. So we're going to be talking a little bit about even male hormone replacement. So you won't be left out. Right? Okay, so we're going to be talking about what is hormone replacement therapy, who uses it, why do they use it, what are the uses for it, what are the side effects of hormone replacement, and what are some alternatives, because obviously we're going to talk about the other things you can do instead of taking a pill or anything like that. So if you didn't know that, sorry, spoiler alert there. So hormone replacement therapy, what is it? It's any form of medical treatment wherein the patient receives hormones, synthetic or natural, to boost the current levels of hormones. So they can do tests, blood tests, to measure how much hormone you have of different various hormones. They can do, I think, urine tests too, and I mean, that's all a pregnancy test is measuring where the levels of the hormones are. So this is going to be a little bit different than that, obviously, but you can go to your doctor and just ask for a hormone test, and they can tell you where your levels are at. And the most common ones that people use hormone replacement therapy for are estrogen and progesterone, which females replace, and that's naturally produced by the ovaries, and we're going to get to a little bit more about menopause here in a little bit. But also testosterone, which levels decline from the age of 17 over the lifetime of a male. So the peak is 17 and then it just slowly declines. So it's less drastic than menopause, where females, the ovaries just pretty much stop working. So there's a huge drop in estrogen and progesterone, whereas testosterone is just kind of, I don't have a graph of it, but if I did, it would be like that. So. Alright, so there's many different forms of hormone replacement therapy. It can be taken in creams, subdermal tablets, which I think that's what they do across the street over here, but I'm not 100% sure on that. You can also get pills, patches, and injections. Pills are the most common form for estrogen and progesterone. I think that might be shifting a little bit now that they're doing more bioidentical hormone therapy, which we'll talk about here in a little bit. But injections are the most common for testosterone. So we're going to talk about the different types. So there's synthetic hormone replacement therapy and bioidentical. And synthetic is actually what, if you know much about this or have read any of the material, they did a health study where they put patients on synthetic hormone replacement and then saw what their effects were down the road, basically. It was called the Women's Health Initiative. It started in the 90s, and in 2002 they actually stopped it because of the side effects that they were seeing from the hormone replacement. So it's basically synthetic is made from, most commonly it's made from Provera, which is an estrogen extracted from pregnant mare's urine. So they, just get estrogen from another animal, and then they put it into a pill form, and that's what you take. And so it's not as, it's a little more non-specific because it's not, we're not horses, obviously, so it's like anything else that you're taking that's synthetic. It's not going to be exactly what you were lacking, but that's what they come up with. And the doses are typically pretty high, and the doses are even non-specific too. So a lot of the times, instead of finding out exactly how much estrogen you need or progesterone, they just kind of throw you onto you're going to be taking this supplement or this hormone, and that's what you're going to get. So, and Provera is a progestin or a synthetic form of progesterone, and this actually has even more side effects than the Provera, because Provera is totally synthetic, so it's all basically man-made chemicals kind of thing. So that is about that. Bioidentical hormones, those are more, they call them natural, but they're actually synthesized in a lab as well. What they do is they use plants, typically, and 80% of the time it's estriol, which is pretty close to the human estrogen that's produced, so they match it as close as they can, so it's there's less side effects. There's still side effects, but there's less, and they're less damaging. So It's typically made from plants, and it's less adverse side effects for that. But like I said, they say it's natural, but I mean anything that's synthesized in a lab, I mean you still have to, they don't sell, you can't get it from a pharmacist, you have to get it from a compound lab actually, so they compound it instead of, so it's still not exactly 100% natural if you ask me. Okay, so who takes hormone replacement therapy? Well, there's 3 groups that we're going to talk about today. There's a 4th group, but we're not going to touch on that. That's people who are deciding to become a different sex. There's hormone replacement therapy for that too, but I didn't go into all that because that's a lot more than I really wanted to handle for this presentation. So we're going to talk about menopausal women. Almost 50%, this was a study done by the CDC, take or have taken hormone replacement therapy. And most commonly they're Caucasian, higher education, and above the poverty line, because I'm pretty sure, I don't know how much it costs to be on hormone replacement therapy, but I don't think it's cheap. So, and I think the biosynthetic stuff that's more natural is actually more expensive. So, and I don't know, I couldn't find a whole lot on that. A lot of them were like, well, your insurance company will pay this much or whatever. So I suppose if I would have wanted to really know, I could probably go somewhere and ask them how much they charge, but I don't know how open they are about that kind of stuff either. So basically menopausal women take it to avoid menopausal symptoms. So that's why they take it. They don't want to have hot flashes and all that good stuff. So surgically induced menopausal women also take hormone replacement therapy, so that's anyone who's had, ovaries removed or uterus removed, things like that, due to cancer or, fibroids or whatever they remove them for. And also men take hormone replacement therapy, and it's actually tripled in the last 3 years, the number of men who take it, which shouldn't be all that surprising considering the baby boomers are getting to that age where they're around their 40s and 50s, and it's became about a $400 million per year industry. So this is kind of a funny cartoon that I found here. It says, night sweats and hot flashes are nature's way of lowering your heating bill so you can save more money for retirement. That's kind of funny. That's what the doctor's telling them. Antivirus. Alright. Okay, so menopause. We're going to talk a little bit about that. Sorry, Brad, it's probably not your favorite subject. It's a naturally occurring process in the life cycle of the human female. The ovaries actually are the only organ in the human body that are programmed to shut off and basically just quit working at a certain time. And it's just part of life and part of how we were designed and how everything's supposed to work. So permanent cessation of function in the human ovaries, it signifies the end of the childbearing age. It typically occurs in the late 40s to early 50s. I think 51 is actually the average age. This means the production of estrogen and progesterone are altered. They don't necessarily stop being produced because there's other organs that produce these hormones too, but the ovaries produce most of the estrogen, so it kind of starts to go down, that's for sure. We'll see a diagram about that in a second here. The body requires these hormones for a variety of tasks, so that's why we get so many different symptoms. That's why you have hot flashes, because the organ that's telling your ovaries to produce that estrogen is right by where it tells you your temperature regulator in the hypothalamus in your brain. So it's telling it to do this thing, and when it's not doing it, then it starts like stimulating, everything going around it, and then that's why you get hot flashes, because it starts stimulating the hypothalamus, which is the temperature control of the body. So, okay. So this diagram kind of shows where the purple line is estrogen and the orange dotted one is progesterone. So you can see fertility years, so basically right when you have your first period, that's where estrogen and progesterone are the highest, basically, and then they kind of level out during childbearing years, and then you can see during menopause, estrogen is just all over the place. And I mean, I personally have not gone through menopause, but I bet you could ask any female who has, and they would tell you, yeah, it's crazy. There's ups and there's downs, and anything from hot flashes to mood. Obviously, this whole cycle of hormones going in and out and up and down, I mean, that's going to cause all kinds of different things to happen. So And you can see postmenopausal, it kind of levels off again too. So thank goodness you don't have to go through menopause all your life. So. Okay, so what are some symptoms? There is a lot here, and so I just kind of, the top 6 actually are the most common: hot flashes, night sweats, irregular periods, loss of libido, vaginal dryness, and mood swings. And then I highlighted in blue just the ones that, off the top of my head, that I can think of that we help with patients in our office all the time. Patients who have fatigue, sleep disorders, dizziness, allergies, anxiety, all of that chiropractic can help with. So, before you jump right into what pill can I take next, you might want to check out the alternative, more healthy options. Make sure your nervous system's functioning 100%. So, I thought that was kind of interesting. So, the most common reason that women take hormone replacement therapy is menopausal symptoms. Hormone replacement therapy can affect many of these symptoms because the hormonal levels have an influence on many of them. So basically just the hormones regulate a lot of stuff that's going on, and that's why we have all these crazy side effects. And it also, hormone replacement therapy also has different effects on different people. So, there's obviously a lot of people get relief from these symptoms with hormone replacement therapy. Otherwise, it wouldn't still be on the market. People wouldn't be buying it. But there's plenty of side effects that we're going to get to, and it also affects people in different ways. And I'll show you the list of side effects, and a lot of them are actually reasons why people get on hormone replacement therapy. They were a menopausal symptom, but then they also could have a side effect of the same thing. So it kind of seems a little counterproductive, but we'll get there. So surgical menopause, like I talked about, removing of the female organs, it's more commonly those patients use hormone replacement therapy because that's not a gradual decrease in your hormones. You don't make them, it kind of just, it's sudden, it's right then. So, and hormone replacement therapy is taken for a longer period of time too because of that, because it's, you could see the diagram I showed you where it leveled off. Well, if you don't have ovaries anymore, that estrogen's not going to level off like it did postmenopausal. So. And it often requires higher doses of hormone replacement therapy because your body could start to adapt to that level, and then you might need to start needing more of it because that's kind of how drugs work. You get used to it, you got to get a little more to get that high. So. Alright, so andropause, which is the male menopause basically, is testosterone dropping. So it naturally decreases as the male ages, actually 1% per year after the year 30. So the decrease in testosterone can lead to a decreased sex drive, decreased sense of well-being, decreased mood, difficulties with concentration and memory, erectile dysfunction, a decrease in muscle mass, an increase in body fat, a decrease in hemoglobin, fragile bones, and a decrease in body hair. I think that, I feel like this is just kind of like midlife crisis, not that I don't believe that andropause exists, but it's just like, I feel like a lot of this stuff is just kind of, that's when you see those older men driving their convertible and dyeing their hair all of a sudden, right? So, in the movies anyway. So the side effects of female hormone replacement therapy, like I said, there's a lot. I'm not going to go through all of them, I don't think, but the ones in red are actually ones that were also on the list of menopausal symptoms. So, so you might not get rid of them. Your chances aren't necessarily that high. So, but the Women's Health Initiative that I talked about that they did, where they put patients on hormone replacement therapy and then they had patients not on hormone replacement therapy, saw what the effects were down the road. They actually stopped it because of the increase in breast cancer and heart disease. So those are definitely at the top of the list there. And anything that increases your risk of stroke is never a good thing, obviously. And then ovarian cancer and endometrial cancer, those are also pretty big. And deep vein thrombosis, which is basically a clot in your veins, which could lead to pulmonary embolism, which is death, basically. So, but just an array of side effects from things that aren't, weight gain, hair loss or gain, maybe, doesn't seem that that bad compared to breast cancer and stuff like that, but there's definitely a lot of side effects. So I don't know if they list all those off when they talk about it on the commercials or not, but and I know that some of the hormones have actually been black boxed, which means, you know, the warning that this is really actually a pretty dangerous thing. So the side effects of male hormone replacement therapy are acne or oily skin, mild fluid retention, stimulation of the prostate tissue. So patients who've had prostate gland problems or prostate cancer oftentimes are advised not to get on male hormone replacement therapy because it can stimulate that tissue. So, and increasing the size of prostate, breast enlargement. So, you know, a little gynecomastia to go with you're already feeling like you're not a man. Well, you can take some testosterone and get some breasts, so it works out. Worsening of sleep apnea, decreased testicular size, change in cholesterol concentrations. It didn't really say if that was good or bad cholesterol that was going up or down. I mean, obviously we need cholesterol, so. And then increase in red blood cell count, a decrease in sperm count. So obviously not well advised for people who are wanting children down the road. And another thing it talked about is that, so menopause, you know, they always say andropause is menopause or whatever, but there's a lot of things that aren't very similar because it's a gradual decrease rather than where menopause you saw that drop off that it had right away of the estrogen and progesterone. So it's a lot more sudden, and also you lose your fertility. So males can father children well into their 90s, I think I saw, so, which is crazy, but yeah, I think you'd be like a great-great-grandpa by then.
Yeah.
Okay, so surviving menopause. So what can we do? Some alternatives that, you know, are positive things to do rather than just, you know, what's the next pill that I can be on here. So change your lifestyle now. So what if, I think that it said a sedentary lifestyle has been linked to an increase in estrogen. So if you have a sedentary lifestyle now or before you get to menopause, your estrogen levels are actually going to be higher, so when they drop off, the effects are actually greater. So if you have a sedentary lifestyle and you eat a poor diet, which is, you know, high in sugar, high in carbs and starchy carbs and stuff like that, your estrogen levels are actually higher during all the time. So when you drop off, it's going to be a lot bigger effects. So eat a clean, healthy diet, organic fruits and vegetables, phytoestrogens. So phytoestrogens are basically plant materials that have a little bit of estrogen in it, so it kind of fools your body into thinking that you still have some estrogen. Free-range meats, avoid refined carbohydrates, like I said, and avoid sugar. That one's not on here, but it should be. These fruits and vegetables that are listed here were actually just on a list of good things that can help you reduce symptoms of menopause, like hot flashes and things like that. Some of them are phytoestrogens, I know, and also I think flax, and you want to watch your soy intake, but soy is a good thing too because it has phytoestrogens in it. Just don't want to take a ton of soy because it can have side effects too. But omega-3s, and it said that it's important to get your omega-3s from meat-based omega-3 rather than plant-based. Plant-based is good, but the meat-based is actually really has more of the omega-3s and more of the fats. So if you take a fish oil supplement, that's good, or you know, if you eat fish a lot too, that's a good thing too. And then vitamin D, which I feel like we harp on about every time we have one of these presentations, but there's just been so much research out there about how important vitamin D is, and the latest research, I believe, said about 8,000 international units per person per day for an average adult. And most of us who live here in lovely Des Moines, Iowa, do not get enough vitamin D just going outside. So get regular exercise. That's important too. Obviously, if you're more fit, you're going to have less of these symptoms just because, like I talked about, that sedentary lifestyle. If you're living that sedentary lifestyle, those hormones are going to be up here. So when they drop, you're going to definitely notice it. So, you know, regular exercise now is important too, whether you're, you know, before you get to it and during menopause as well. getting 6 to 8 hours of sleep a night is important. The body heals then, and it also rejuvenates you, and you can have better mood if you sleep and rest properly. I know that I used to always be grouchy when I had sleepovers when I was younger. My mom would always say, you need to not do that because you'd be grouchy. So. Green tea is a good thing to have, and it has some phytoestrogens in it too. Black cohosh, which is a plant, you can find it in a lot of these health food stores that we were talking about, and that is on a lot of lists for reducing hot flashes. So if you don't want to know what it is, look it up, do a little more research on it. I don't know how much you're supposed to take to reduce hot flashes for sure. I'm sure it depends on what kind of, how big you are and how severe your hot flashes are and all that kind of stuff. But eliminate sugar, decrease caffeine. Caffeine and alcohol were both on everything I read. Was like, if you eliminate caffeine, eliminate alcohol, that's going to help everything that's going on. So, and drink half your body weight in ounces of water every day. So we always talk about water here, and that's about the only thing we drink here. So it's very important just for healthy lifestyle, not just for this, but I think about every presentation we've talked about. So testosterone levels, basically, live a healthy lifestyle now. They tested people who took testosterone, and the regimen for taking testosterone is shots, and they give them like 2 weeks apart, I think. Every 2 weeks you get a shot of testosterone, and they alternate which butt cheek you get it in. So that I thought was kind of interesting. But they found that people take testosterone because they have a decrease in muscle mass and strength, but the muscle mass might increase, but your strength actually does not increase. So I thought that was interesting. And decreased testosterone isn't life-threatening, so you can live without your testosterone riding way where they were when you were 17, So, and that kind of goes with menopause too. I mean, obviously, it's easier for me to say it because I've never gone through menopause, but a lot of these side effects that effects of menopause are just kind of more inconvenient rather than, they probably alter your life, I'm guessing, for a few days or a few minutes or whatever, but I don't think that they're that extreme that, I wouldn't want to go into and take a drug that had so many side effects, I mean, increased risk of breast cancer, ovarian cancer, all that, just because you don't want to have hot flashes or mood swings, I don't know. To me, it doesn't add up, but... Okay, so hormonal changes are a natural part of life. Menopause is natural. It's supposed to happen. You're supposed to change as you age. And living a healthy lifestyle can alter the effects of these changes will have on your life. So, like we always say, function well, eat well, move well, and think well. So, what we talk about all the time in here, and you guys are already in the right place. You've got your nervous system functioning at 100%. Those hormone levels are going to be a lot less crazy if if your nervous system is taking care of everything. So, eat well, move well, think well, like we talk about all the time here. So, that is actually all I